All right, let's talk about endotracheal intubation or placing a breathing tube. This is a very common procedure pretty much any time a child's having surgery or if they're in the intensive care unit and have organ failure for some reason and we need to keep them safe by placing them on the mechanical ventilator. So I want to talk through what this provider is doing at each step. Let's look at this first part. You can see the patient is sedated and has a mask with air going through it. There's a specific type of air that's going through that though. So it's 100% oxygen. Basically, the air we breathe is 21% oxygen, 78% nitrogen, and then a couple other gases. Before you go to intubate someone, you want to give 100% oxygen because you want those lungs to fill with oxygen so that when you go to put the tube, they don't desaturate or their oxygen level doesn't drop. While you're placing the tube, the patient isn't able to take breaths on their own, so there's a risk of that happening if it takes too long to get the tube in safely. The other part that's really nice in this video is that she has him in a very nice position. So remember that the trachea is actually in front of the esophagus. What we're trying to do is get a tube into the trachea that goes down to the lungs. If I just took a tube right now and put it down my throat, it would almost definitely go into my esophagus towards my stomach, which is not where we want it. So you need the patient in what we call the sniffing position, where it's like you're sniffing something, but you want the head kind of forward into a position where when you put the blade in, you're actually able to see anterior, to see forward in the neck to identify the vocal cords, which tell you you're going down to the lungs, not the esophagus. So we'll see what happens. She has him in good position, and then she puts the blade in, sort of sweeps the tongue a little bit to the side to get it out of the way, and now she's just looking, trying to get a good position, and probably looking at the esophagus right now. Can't quite get a view of the cords. Now manipulating it from the outside and says, oh, I don't know. Okay, now I think she has a view of the vocal cords, so she grabs the tube, places it through the vocal cords, and then, very importantly, once they hook up the ventilator, they want to confirm, okay, I think that was the vocal cords. I think we're in the trachea, but I'm not totally sure. So you'll see they pan over and look at the monitors where they look for evidence of end-tidal carbon dioxide. So when the patient breathes out, are they seeing carbon dioxide on the monitor? Because that would mean they're actually in the trachea, not in the esophagus. Similarly, you want to make sure that you didn't put the breathing tube in too far. So you'll listen to both sides of the chest to make sure that you didn't do what's called a main stem intubation, where you actually went past the trachea into a bronchus, where you're then only putting air into one lung. Anyway, I don't know if that was interesting or not, but I hope you enjoyed it, and thanks for listening.